There was a silver lining to what happened about 6 or 8 weeks ago when the question about the Catholic churches and the Catholic hospitals having to provide abortions began to surface. There was a silver lining. For the first time, a lot of American people started to realize Obamacare is about a lot more than health care. It's about the government getting every single aspect of your life. And that was a good thing. We have to repeal Obamacare. It is wrong in so many levels, and what we have to replace it with, this goes to my argument, I get frustrated with Republicans who won't make the argument. They may criticize, they may vote the right way, voting no against Obamacare, but what are they doing to come back on the other side and say, this is what we should be doing? Here's what we should be doing. We should have a national plan. Our national health care effort should focus on patient-centered health care and private market, free enterprise systems. We have to have a health care system that, number one, allows insurance companies in the health business to do exactly what automobile insurance companies can do, which is to compete across state lines.
Yes.
Bring more competition in, and it will drive costs down, and it will cause quality of service to go up. We have to have a national premium support program for those on Medicare to make sure that when there is that copay they have to do, that it is affordable and it is something that seniors can live with due to the escalating cost. For those younger folks who are still in the workforce, we have to greatly expand the availability of healthcare savings accounts, and we have to expand them in the sense that their contributions need to be enlarged. And I'm saying by that the limits need to be raised so they can put more in to save for their future. Here in Indiana, when the governor came in, he promoted health savings accounts with state workers. At the time, there were like 4% of state workers who had them. Now it's something like 80%, because they realize they're saving money for themselves that they can use in the future. It's just a great way to put people in charge of their own health care costs, as opposed to just letting the government bureaucrats pay the bills. And guess what? When it's not your money, you don't really pay attention. That's a serious problem. We need to have a national health system that allows for more healthcare insurance pools so that smaller companies can enter pools, and basically you get the benefits of the economy of scale, so that smaller businesses can have more affordable access to healthcare insurance as well. Something we don't need is something called the electronic data record system that is currently in the process, that would cause every physician to put all of your health records in an electronic database that ultimately is controlled by the United States government. To me, that is scary, it is appalling. It sends a chilling message that the most private information that you have with you and your doctor someday will be available to a government bureaucrat. Not that we would ever see a government database hacked. Like that's never happened. I was doing a radio interview the other day, and this came to me just when this subject came up, and I didn't think about it before I said it on the radio. I don't know if I said it appropriately. But I say what I think. And what I said to that radio interviewer was, can you imagine this today? Some 16-year-old girl finds herself pregnant, gets an abortion. That's part of her health care record forever. Years later, she comes to realize that she wished she hadn't done that, and I can't imagine a woman in that position, but where she has some deep regret, it is something she doesn't like to think about, and then someday somebody gets access to that information through the federal government and makes it available. Can you imagine a situation where, and let me combine two things here. There are currently something called, it's either ICD or ICB codes. Anyone in the healthcare business here? Okay, well there is a series of codes. A doctor must fill out for payment. He has to select these codes that the federal government issues, the ICD codes. There are no less than 144,000 codes. If you have a broken wrist, as many as 1,500 codes can apply to that one injury. I'm not making this up. There is literally a code for an injury sustained by walking into a flagpole. And I guess there's probably another code for a fence post. They're seen as different. We have physicians, and I've been able to spend a couple days with different physicians in the state as they've been showing me how this works. They're filling out codes and filling out codes and filling out codes, and every year they may be audited by Health and Human Services. And if they audit them and they find out that 8% of the codes or 10% of the codes were filled out wrong, then the federal government can come back and get 8 or 10% of the money they paid them, claw that money back, and possibly subject them to claims of fraud, felony fraud. Now, I'll tell you as a business person, I spent 31 years in the coal business. In that business and in every business, there is a way to measure your productivity. That's whether you're successful or not. In our business, it used to be how many tons per man per day did we produce. If you're in agriculture, it's how many bushels per acre. There's some yield of your productivity that you can measure, and the higher that number is, the better you are. I make that point because I had a doctor tell me recently today, or the other day, if I didn't have to be filling out all these codes, instead of treating 40 or 50 patients a day, I could be treating 70 or 80. In other words, his productivity goes up and healthcare costs go down. It is the mandate of these types of rules through Obamacare and this increasingly large federal health system that is causing costs to go up. They're saying they need to bring them down, and they're the ones who are causing them to go up. That's why we need to repeal Obamacare. That's why we need to get to the more patient-centered approach instead of the government-centered approach that is currently the very basis for all of our health care. It is a crazy direction in which we are going, and it needs to be stopped. It needs to be repealed. And if we have a Republican House and a Republican Senate and a Republican White House, I'm confident it will be. I mean, we cannot keep going this way.